Welcome back to Neighbors in the Network. I'm James Pinedo, joined by my very special co-host, Corey Burres. Corey, thanks again for stepping in for this episode.
It was a fun discussion. I'm excited to dive in.
I am too. So we interviewed on this episode Nic Dunn, the Vice President of Strategy and Senior Fellow at the Sutherland Institute. As VP of Strategy, Nic oversees the execution and strategic external impact of Sutherland's written and multimedia policy content. In his capacity as Senior Fellow, he leads the policy research, coalition building, and public advocacy for policies that strengthen opportunity and upward mobility. This policy focus includes social safety net reform, workforce issues, and support for the well-being of men and boys. His expert commentary and analysis can be found on Sutherland's weekly podcast, Defending Ideas, an excellent way to spend your time listening to podcasts, as well as in major outlets like Deseret News, Washington Examiner, National Review, and other Utah print and radio outlets. So, Corey, this interview went so well, we decided we were going to cut it into two segments. Can you walk us through what really stood out about the first segment?
Well, I think Nick does such a great job of outlining the issue of welfare reform and in many ways the kind of moral obligation that we have on our side to actually address this problem outside of a fiscal responsibility, but also as if we believe in self-governance, if we believe in these values that we hold, why is it that something like welfare reform is should be such an integral part of what we do in organizations to address this at a policy level?
I love it. And his focus on stories is always so engaging. Shall we get to it?
Let's go in.
Nic, thanks again for joining us here on Neighbors in the Network.
Thanks, James and Corey. Good to be with you guys.
So, Corey, you are first up.
Nick, I know you pretty well. We've talked a lot. You kind of organizationally have made quite a shift there at Sutherland, including in your role in terms of taking on welfare reform. Kind of what was the kind of like thing that triggered you guys going, hey, this is something we have an opportunity to have a voice on, but also an opportunity in our state to tackle welfare reform? That seems like a very big thing to take on.
It is, and I think there's a few pieces of context because for listeners out there, it might be odd to think, well, why is Utah trying to lead out on poverty and welfare reform when you look at a lot of the data metrics showing that Utah is at the top or near the top when it comes to poverty, upward mobility. Archbridge Institute, our friends over there, have a great index that shows upward mobility rankings by state. Utah ranks number 1 for upward mobility. Utah gets a lot of national recognition, especially lately, for our one-door model, where welfare programs and workforce programs are essentially co-located under one state workforce agency. And so you kind of go down the list and you think, well, Utah's actually doing really well. We have low poverty rates, strong economy, high upward mobility rates. So it might be normal for someone to think, well, why does the state of Utah, why does Sutherland Institute feel like they need to focus on this? And I would say it's precisely because of where we sit as a state when it comes to poverty and upward mobility that we think there's some real value in getting into the welfare reform space, both organizationally as Sutherland Institute and just as a state in Utah. And I think a couple things have helped to precipitate that. One, the recognition of how strong our economy is and how much vibrant upward mobility we have in the state. We still recognize there are pockets, in some instances significant pockets, where people don't seem to benefit from that upward mobility in the same way. For the better part of over a decade, the state of Utah was engaging in a very vigorous effort to address intergenerational poverty, starting back in 2012 with some legislation and a statewide initiative that ran for years, collecting data and trying to identify solutions. And I think it's really a testament to the spirit and culture of Utah that even if we rank, again, number 1 or close to number 1 on low poverty and high upward mobility, there's this kind of spirit of, well, that's not good enough. Some of our fellow Utahns are still stuck in poverty, and that's wrong. And it's wrong that of all places, Utah, that has such opportunity and upward mobility, that there are still families that feel stuck. That's something that it's not right, but we can fix it. We can make a difference. So it's a little bit of that spirit of continuous improvement that for any state that ranks high on any number of issues, it's a serious risk to kind of sit back and rest on your laurels and think, well, we do really good in this area. We don't need to do anything. That's how you start to decline. And so one, this recognition of we want to still get better for the Utah families that are struggling. And I've sat and I've had them in our own podcast studio sitting right across from me, largely single mothers, articulating their struggles and their desire to work up and work out of poverty. And if I came back to them and said, well, actually, Utah ranks #1 for upward mobility. We have a really strong economy. We have low poverty rates. So, mission accomplished. That's not good enough for those families. We still need to do some additional work to help them succeed and take advantage of the wonderful free enterprise system that we have in this country and in Utah especially. And the second piece of that is this recognition of the principle of federalism, of states being able to be the laboratories of democracy and model solutions that can be helpful in other states or at the federal level as Congress considers reforms. So that's an especially important one. In my view, if there's any state in the nation that's going to really engage in constructive welfare reform to strengthen upward mobility for families to feel stuck, it's going to be Utah, because we have this foundation upon which we can build to really make a difference for these families. And I think the one-door attention that we've been getting has really helped to precipitate some of this, because a lot of other states and folks at the federal level in recent years have been looking to Utah saying, well, the fact that you guys are a little different, you have your, as I mentioned before, your workforce programs and your welfare programs, so to speak, housed in one state agency to create a better, more efficient experience for the customer, for the person, the family who's trying to get back on their feet. That's unique, and other states want to replicate it. So it's kind of like going from good to great. We want to make sure that we can take what we've done well as a state, but then build on that to make a difference for our own Utah families who still struggle, and also export some of those ideas that are successful to other states and to our friends in Washington.
Nic, you spoke about some of the stories you've heard from, I think you said moms on welfare or things like that. And that immediately made me think about that report that you made with another SPN affiliate. You guys teamed up with the Georgia Center for Opportunity to make that report on strengthening the American dream. So what did that report reveal? Because you had some heartbreaking stories, some just incredibly engaging stories in it. And what was your experience working with GCO?
Yeah, so the report, Strengthening the American Dream, is really focused on disincentives to working that exist in the social safety net. So the term is benefits cliffs. And for your folks out there who may not be familiar, a benefit cliff is essentially when a person or a family who's on a public assistance program like Medicaid, food stamps, a child care subsidy, housing, those kinds of things, as they earn more and more income, as their earned income increases, they hit various eligibility thresholds tied to their income. So a benefit cliff essentially is if you earn a little bit more, you might lose a lot more from one or multiple of those programs. And so in some instances, a very small raise can trigger, in some of the stories we've heard, a disproportionately larger reduction in public benefits. So you could say, well, I got offered a raise, I'm earning more, but when I look at my total financial situation for my household, I'm actually worse off on net. So that's kind of the phenomenon of the benefit cliff. That there's been widely documented research of this issue for years and years and years all across the country. And we have been hearing about that anecdotally here in Utah for a number of years. In some of my past roles throughout my career, I've had the opportunity to work on this issue in a number of different capacities over the years. And, I used to work for the state, for the Utah Department of Workforce Services, and then I worked for the Salt Lake County Council as a policy advisor. And even in the private sector perspective, I worked for a Chamber of Commerce for a while. Through various lenses, this issue was kind of arising of there are families who want to work or want to work more, but feel disincentivized because they fear, sometimes rightly, that if I earn a little bit more, I'm going to lose a lot more, and it's just not worth it. And so that's kind of the issue that's been percolating in welfare reform policy circles for years. But here in Utah, we really wanted to get to the bottom of it. And so a number of years back, actually, we initially started having conversations with the Georgia Center for Opportunity. I was actually working for a different organization at the time, but started talking to our friends in Georgia that, in my view, the Georgia Center for Opportunity is one of the best institutional leaders on safety net, welfare reform, benefits cliffs that you will find. There are many amazing leaders out there throughout the country, but the Georgia Center for Opportunity, they're good at this, and they're very thoughtful and pragmatic and principled in how they approach it, and they bring data and good analysis to the table. And so we partnered with them initially to bring their calculator tool to Utah, essentially to have Utah added to the benefit cliff calculator tool that Georgia Center for Opportunity had created with a number of states on there. And that was the first time we as a state kind of took a leap from anecdotal evidence. We just hear stories for years from moms in poverty, from caseworkers, from nonprofits saying that the benefit cliff is a real issue here in Utah. So the calculator tool allowed us to then model what it looks like, just using modeling data and eligibility criteria and things like that. And that was a big step forward because we were able to start having policy conversations about these aren't just stories we're hearing. We can model what this actually looks like. But we also realized, especially here at Sutherland, that there was still a gap in the evidence, a gap in the data, especially at the state level. And one of the big questions that kept on coming up over and over again was this idea of a benefit cliff. How often does it actually influence behavior? How often does it actually change the decision-making for these families? Because it's one thing to model it. It's one thing to say we've heard stories. Because if it's only a few people, a few families a year, maybe it's a very minor problem. If it's thousands, I mean, there's a real scope question there. And so what we wanted to do was really get to the bottom of how are actual families on these public assistance programs changing their behavior because they're worried about benefits cliffs. So that's what we did. We partnered with the Georgia Center for Opportunity to do a couple of things. Number one, we did a statewide survey in Utah that was statistically significant with statewide survey data of safety net participants specifically. So we polled families in Utah that currently or recently have participated in one or more of these programs. And then we also did a couple of informal focus group conversations, including with some folks in Georgia, again, thanks to our friends at GCO for helping to set those up, to get some additional stories and anecdotes, but also demonstrate that this issue is national in scope. And so the survey data was really the first time that we had something on a statewide level that was statistically significant, demonstrating, yes, Utah families actually are, at times, constraining their economic progression because they worry about triggering a benefits cliff.
Yeah, that's fascinating because it's one of those things where I love that you did a deeper dive into the research because like we can look at numbers all the time but we always said like numbers represent people, right? And so to hear the stories and to hear the actual experience about what is happening on the ground when we say X number of people are experiencing this, how does that actually change behavior? I think that's a fascinating thing. One of the things that you guys said on, I was watching some clips of your podcast, and you interviewed Les Ford, who works on the Alliance for Opportunity, which you guys are a part of, and you spoke about needing to create a smaller federal safety net, and how that actually is the goal. And that to me, like I'm sure outside of organizations, a lot of people think that sounds counterintuitive, right? Like, well, we need to actually expand it. We need to make it bigger so that more people get caught by it. What is the thought process behind that? What do you guys, how does reducing the federal safety net actually help in the long run?
It's a great question because it is a little counterintuitive, and the way I would articulate it is, I'm a political conservative. I believe in the typical things of small government, limited government, and those kinds of things. But the way I would articulate it is it's less about just purely the size, the scope question that matters, but it's more about the targeting. If you better target these kinds of programs, and this is one of the things that Les Ford articulated very well on that episode, was that if they're truly targeted to the folks who really need it, who we would all agree across the country, this is who the safety net is for. If we really target those people, it probably will just by default be smaller because you're calibrating the system in a better way to address the true need that exists. And the way I would articulate that further is the real question is, okay, what is the philosophical purpose of the social safety net? I would argue that the reason we have a social safety net in this country, we're blessed to do so because we're a wealthy country. I think it's good that we have a safety net. But the reason we have it is to provide some temporary stabilization to families who are struggling or down on their luck and facing some difficulties. Help them in the moment to be stabilized, to meet their immediate needs, make sure their kids in particular have the things that they need within certain parameters, but then also work to move them back towards what I call work-based self-reliance in the most effective and efficient way. That's a little bit different of a framing than sometimes we hear. Sometimes we hear that the safety net is there just to take care of people. And in fact, in Washington, D.C. right now, there are a lot of debates around Medicaid, around the food stamp program. And you'll hear a lot of these points of, well, is the purpose of food stamps to alleviate hunger, or is the purpose to boost nutrition in low-income families? Is the purpose of Medicaid just to make sure that everybody gets health insurance who's eligible, or is it to improve health outcomes? All of these kinds of things are very important considerations that we need to think through in a careful and deliberate way. But I think all of these questions should sort of subsume into this overall vision of the safety net, that it's here to help temporarily and get you back on your feet. And that latter part is what sometimes I think gets missed in these conversations. And if we're talking about the right way to target the safety net, if it is temporary, if it is less of a safety net and more of a launch pad back up into upward mobility, into work-based self-reliance, I think there are a lot of areas where we can be more targeted, more lean and efficient with our use of resources. So that philosophical framing is important when we're talking about the size and scope of these federal programs. And I think the last point I'll mention there is that I think that's actually what families want more. And again, we've asked the families, sat with them face to face, talked to them in focus groups, looking at the survey data. Again, our friends at the Georgia Center for Opportunity have done this for years. When you interact with these families directly, rarely would you find, I have never found anyone in the years that I've been working on this, who says, I'd like to stay on food stamps and Medicaid long term. That'd be my preference. There may be some out there. I have not encountered them directly. These families want to work. They want to be self-reliant. They yearn for that. They hunger for that. But in the case of benefits cliffs, they feel like there were just disincentives or barriers in their way. And so the families themselves that these programs are designed to help do not want to stay on these programs forever. And so we need to make sure that we're talking about the system in such a way that it is temporary, it is work-based, it is oriented towards upward mobility. And that's how I think you get to a targeting conversation that can yield some efficiencies as well.
Yeah, I was watching a podcast the other day. Jon Stewart was talking with someone, and he was mentioning, and the person on there was talking about, well, if we just spent X percentage more on poverty issues, we could actually get rid of poverty. And I was like, no, what you're talking about is actually, I'll use the word subsidizing poverty, right? You feel better about yourself because those people are no longer below the poverty line, but they're still reliant on government. They're still living in the same environment that has held them down this entire time. What we're talking about is actually solving the poverty issue, creating paths out of where they're at, giving them opportunity. And so it's a mindset change, I feel like, that we need to kind of shift in how we look at these solutions, how we look at welfare, how we look at poverty overall.
Corey, if I can give an analogy that drives that point home, imagine you guys or any of your listeners out there, if you had a friend or relative who came to you and said, if someone came to me and said, Nick, I'm really down on my luck. I lost my job. I don't know what I'm going to do for money. It's really tough right now. I need some help. And if I said, you know what, I've got a basement. You can crash there, eat whatever you want out of the fridge. If you need a little help paying your bills, if I'm able to do so, I will. Those kinds of things. If you have that conversation with somebody, they say, thank you. That's so nice of you. And then they're crashing on your couch, living in your basement, eating your food. Again, a wonderful, very, very Christian, generous thing to do. Would you then go in conversation with others and say, hey, I solved poverty for my friend here. He's not poor anymore.
Right.
Because he has these things covered for him. No, that would be silly. What you would say is, he's down on his luck, and fortunately I'm able to help him out for now. But I also want him to get back on his feet. And so I think the distinction is a term that I don't know where this came from or if I'm imagining it, but the term I would apply is latent poverty. That a lot of the folks who say, well, if we just expand the social safety net, we can reduce poverty. Even sometimes some of the conversations on the political right around how you count what they call transfer programs, again, food stamps, Medicaid, and so on, as far as their efforts to alleviate poverty, to say, well, if you account for these programs, the poverty rate is actually a lot less. Yes, we need to account for the good these programs do in alleviating material suffering in the short term. That's very, very valuable. But that doesn't mean we have actually alleviated poverty, because a true poverty alleviation vision should be moving as many people as possible towards work-based self-reliance. And that's a very important philosophical distinction that, again, it goes back to what is the safety net for? Is to help people, after they're done using the safety net, to look back and say, I'm so grateful I had that food resource, so I knew I could feed my kids nutritious food. I knew I could give my kids some health coverage that they needed. I knew we would have a safe place to sleep. But I also knew that I was working. I was gaining skills and credentials to get back on my feet. And now look at me. I'm working. I'm providing for my kids. I don't need government assistance anymore. That's the victory that we're going for, not simply a provision of resources that temporarily alleviates those material needs. And that's a very important distinction that we need to talk about more at the state and national level.
Thanks for listening to part 1 of our conversation with Nic Dunn of the Sutherland Institute. Join us next week as we continue the conversation and Nic shares some incredibly engaging stories. We'll look forward to catching you then.